Suncoast Community Health Centers provide extensive services for the whole family. Here today to tell us what they do for kids that sets them apart from the rest are Dr. Torres and Carmen Laguna. Good morning, ladies.
Good morning.
We love having you. So happy that you guys are back with us today, especially you, Dr. Torres. Carmen is a new guest here on The Blend, but you're talking about a new program. So start us off, Dr. Torres. What's involved here?
Well, we started a dental integration program back in July 10th, so shortly, like about 2 months ago. And basically what it is that we've incorporated a dental hygienist into the pediatric program. And usually the American Academy of Pediatrics, what they recommend is that you bring your child to the pediatric dentist by the time they get the first tooth.
Okay.
Tooth decay is actually the most prevalent disease in preschoolers. By the time the kids are 2 years of age, actually about 10% of these kids will have one or several cavities.
Really?
By the time they're 3 years old, that increases to 28%. And by the time they're 5, ready to go to school, about half of these kids will have dental cavities.
Wow, Dr. Torres, my daughter already has a first tooth. I didn't know I was going to be making an appointment today, so I learned something new here. But talking about the importance of starting them off early, what services do you provide for these little ones, Carmen?
Well, we provide oral health risk assessments, nutritional counseling, oral hygiene instructions. I do a complete oral screening where I'm looking inside the child's mouth. I'm trying to detect if there's any signs of disease. And so what I do is, as I have the child in my presence and the parent next to me, I get to show them what's inside the child's mouth. Most parents are not familiarized with the difference between baby teeth and adult teeth. And so what I have noticed mostly is that most parents, they don't put too much emphasis in baby teeth. A lot of cultures, and I am one in a Hispanic culture, we think that baby teeth are just going to fall out. There's no importance towards it, but that is not true. We want to maintain baby teeth healthy for as long as when they're in their mouth, and their last baby tooth usually falls out around the age of 12 years old. And that's something that most parents are not aware of. So when I educate the parent about that and I talk to them about how maintaining good nutrition, a diet low in sugar and starch, making sure that they're taking care of their children's teeth, helping them brush and floss, but most importantly, getting them to see the dentist early, in the early years, then we can all, in a collaboration, prevent their child from developing cavities, and that's our goal.
And I will say I'm fascinated about this educational component that you're able to offer too, because that's got to be important. I mean, I'm already trying to pay attention to, what I'm supposed to give my daughter and, what stage of food she's on. But you're saying I need to kind of focus on the aspects for her mouth as well.
Absolutely. I mean, I talk to parents about weaning the child off the bottle by age 1. Do not put a child to bed with a bottle filled with sugary liquids, juice or milk. I mean, this is what puts a child at risk early on for dental caries. It's sad when you see a child, 1-year-old, 2-year-old, with a mouthful of cavities. And so when you express that to the parent and you really teach them about the importance and how this can be very traumatizing for the child, they feel it in their heart. And it's an awesome opportunity that I get to do this with Dr. Torres. Most parents don't bring their children to the dentist at an early age, but they will bring their children to see their medical physician. So this is a beautiful opportunity, a unique program where I collaborate with Dr. Torres, and as part of the health maintenances, I can come in and do my part and focus in the mouth while Dr. Torres focuses on the rest of the body.
Wow, Dr. Torres, I mean, again, this is a new program, but when patients do come in and see that you have this service now, what's been the feedback so far?
They're very satisfied, actually. And this is an opportunity not just for the patient, but for the families as well. Carmen is very thorough. She takes a thorough history about their nutrition habits, their dental hygiene habits. And actually, she teaches the parents on how to take care of their dental issues.
Yeah.
So it's a whole family deal. The parents are very happy. They get out of the clinic and they're just like very surprised that we're offering this service for them.
Good stuff. Well, if you want more information on this service, I've already learned a lot from the both of you, so thank you for coming in today. But again, go ahead, visit their website, give them a call. There's the information for their locations as well as their contact information. Ladies, thank you both again for coming in today.
Thank you for having us.
Thank you for having us.